Hi, everyone, and welcome to another episode of Aila Health's Patient Spotlight series. I am here today with Kelly Fan, who is a freelance worker, a mental health advocate, and a special education teacher. She's worked closely with hospitals and specialists, and she volunteers at international conferences for obsessive compulsive disorder. Her work in the OCD community is robust and was born out of her daughter's struggle with the disorder. And Kelly herself has a long history with chronic illness and autoimmune disease, and including most recently her experience living with long COVID. So really wonderful to have you here with us. Welcome.
Thank you so much. Thank you. So I guess I'll give a little overview of my journey.
Yeah, please.
Yes, so in 2006, I was traveling in China with family, and I came down with a gastrointestinal. We thought it was a quick, traveler's diarrhea, which is common. It was probably lasted about a week, and it's probably about 2 months upon returning to America, I became very seriously debilitated. All of my symptoms were neurological, and really at that point, I was no longer able to run my company. I was actually a hair designer and a makeup artist back then. Have had many careers, but I was, zooming through the state. I was able-bodied and very healthy. I did film and weddings and really wherever I was needed. So, upon these symptoms that just kept rolling in fact, of course, like any of us, I just started writing everything down and kept journals because it was all so bizarre and sudden and just utterly frightening. From there, gave up the company, and of course, really, I was housebound. I had days, difficulties even walking down the stairs, along with, it seemed like one symptom would morph into the next. In fact, it is odd. A lot of what I hear from the long COVID world, it really sounds a lot similar to what was going on with all of these bizarre, kind of affecting different body systems, and things just kind of like the virus wreaking havoc on the body in all ways. So I had a lot going on. I had no answers from the medical community. My doctor was perplexed. The most I ever got was that, you got a virus that attacked your central nervous system. Nothing really officially in writing. It was very elusive. So I did manage to get up north. I'm in New Hampshire. I went to Dartmouth, went to all the specialists. I was actually told, and this was kind of like this long journey of what I consider like the kind of secondary trauma of living with chronic illness, is the dismissiveness that can occur when they don't have answers. If they, a lot of times with my symptoms, they were so fast and furious, and then they were fleeting, and then I had a new set, but they were always neurological. It was just very bizarre and quick moving. I was told that it was stress, depression. At a later point, I was even told, a psychogenic disorder, which I really, when I think about those things, that makes me very, very upset. That's just that feels so unfair that I am using my voice, telling you what's wrong. You can see some of it. I'm recording, writing down in my journals. This is my day to day, and then you're telling me what my experience is. It's a tough one. So that's kind of like been the side battle. But all in all, I managed along with the help of my family, of course. I stayed housebound without driving for a couple of years, actually. And then I did have an autoimmune disease that the symptoms started. And I noticed a lot of dry symptoms, dry eyes, dry mouth, like abnormally so. And from there, I thought, well, this is awfully strange. What are we doing now? It's always the guessing game. So I, of course, started writing down my symptoms and kind of trying to come up with some way to measure and, research different things. So we quickly become our own advocates when we're, so debilitated. Along with the dry symptoms, I would have neurological flares. So the neurological rampage that was kind of like throwing me into a lot of, symptom after symptom for a couple of years after my visit to China, that morphed into an autoimmune condition. And it's actually Sjogrens.
So your experience with becoming sick in China and visiting the medical doctor since then, you were not able to arrive at a diagnosis of what this gastrointestinal issue was?
No, they could never point to anything. After the fact, I had been a month or so, I was back in the US. So there was no real, it was all kind of guessing at that point. I did have an IV in China as well on top of things. Because I always record like, what happened? What did I do? What were each step? What did I eat? What did I, that's just, I think, normal when anything traumatic happens to us. So no real answers to that. But
later, as you were just explaining, this manifestation of new symptoms, did end up receiving a diagnosis of Sjogren's, right?
It's interesting. Sjogren's, all of the symptoms showed up, the dry eyes, dry mouth, and what Sjogren's syndrome is an autoimmune condition where your immune system attacks the moisture producing cells in the body. So that includes, every system, and your skin and eyes and digestive system, so all of it. So that kind of just took right over. And along with that, I have complications with the neurological system. So I've had for over a decade neurological flares. A lot of those original symptoms have quieted down. I mean, I'm still limited every day, but they kind of probably split the switch to an autoimmune disease. And so, yes, that's been my experience for over 10 years of the neurological flares. And they follow a pattern. It's usually with the hormonal changes. So I can pretty much guess, like every month I'm going to have a neurological flare. I can feel them coming on. They start in the neck, inflammation, tingling down the spine, and then the brain. The only way I can explain it is like hot water or fire on the brain, and that is a neurological flare. That's what I experience. And over the years, my doctor has written, like, so I can have days off, and I'm really not able to function during that time. So it is a tricky one, because a lot with autoimmune, you wax and wane, and you can look great. You can, somebody will see you without a flare and think, what's wrong with you? But because of the invisible nature, and it just it can be tricky. But it is a balance again, I've not really received any help from the medical world. There isn't much help, actually. Steroid treatment, so to suppress the immune system. And they did try that once, but I was too sensitive. I could not tolerate the treatment. So I have gone without. But I had all of my notes recently, because I've had all these different changes currently. I did discover something, and these are all my notes from going to dry needling. So back when the doctors were just like, we have pharmaceuticals and tests, that's pretty much all we can offer. I remember sitting in my garden. I was feeling pretty defeated at that point, because I didn't have any help. What's going on? What's the next step? And it was rough. It was really rough, obviously not being able to get up and do what you want, and all the loss that comes with it, all of it. And I remember sitting in my garden, and I mean, this sounds really crazy, guys, but I'm an intuitive. Like I meditate, I work in energy healing, and I looked at the bees and the flowers, and I was like, oh my gosh, it would feel really good to be stung by the bees. I don't know where that came from. It sounds really crazy. Apparently there is this whole theory on, there's a therapy that goes with it. But from that kind of premonition, I said, wait a minute, let's look up dry needling and see if we can get into the muscles to change them and physically change them. It's a feedback loop. And that is exactly what I did. I went from that, along with a few other things, I was able to at least I always look at it like this. There's a path to healing here, and then there's a path to continued, debilitation or whatever. And if I can at least take one step down that path to bring me back to balance, or balanced state, then that's my goal. That's how I have to manage every day. The dry needling for me, it's an intramuscular procedure with the needles. It's actually the acupuncture needles. They go into the muscle. You literally see the muscle twitch, and then they release the needle. So for my condition, being neuromuscular, where my muscles would seize, or I would have almost like seizure-like activity during a flare, this was phenomenal. This allowed me to work and use my muscles. And like I showed you the notes, that's probably 6 or 7 years, every single week, every week. That is what I've had to incorporate in order to keep myself going. It's painful. It's a real dedication. But for me, I thought, no, absolutely. If this is going to give me the ability to work or be in the world or what have you, that was just one little piece. I mean, that didn't wipe everything away. I still had flares. I still had, so many limitations. Another big thing. Yeah.
I'm hearing so much in what you're saying here, and part of it, certainly is being an advocate for yourself when, you're going into these doctor's appointments and you're seeking care and maybe not coming to answers, but then deciding, okay, what can I be doing to manage my own health? And it sounds like one of those ways is looking into alternative treatments and looking into these alternative therapies that might be able to provide symptom relief and just enable you as you're moving along this wellness journey, which is really important. And I want to come back to that piece, but what I'm also curious too is to hear a bit of your experience around, if you fast forward these years and, to the COVID-19 pandemic and then becoming sick with COVID-19 and how that, what has life looked like for you in that process?
Well, it's deja vu for sure.
Yeah, because I'm hearing so many similarities here with, this medical journey that you've been going through the last, decades, and then how it's all deja vu. Yeah. Please tell us more.
And since August 2020, I have my log of my journal because things were acting wacky again. I had a sore throat, a fever, and a headache, and those were very unusual for me because even with my cluster of very specific autoimmune symptoms, I very rarely got sick. I never had respiratory issues. There were certain things that I was used to and I kind of lived with. But then August 2020, I got this new cluster of symptoms, like a headache, for instance, that was very rare for me. That morphed into one thing into the next. I had shortness of breath and painful, like pressure in my chest. And these were pretty fleeting for the most part. And I remember my taste and smell being altered. And then that lasted, it was probably about a week. And then I had phantom smells, and all very, very bizarre, very different. And also kind of like, is this really happening? Because they were so different. I just found all the symptoms with COVID very, very foreign, like very bizarre. I don't know how to explain it. Like even the sore throat didn't feel like a sore throat I'd ever had before. It was like an obstructed feeling, or I don't know really how to put it. So that really launched a bunch of stuff for me. I had digestive issues. Then I had like out of the blue infections that I had never had in my life. And so it was like all systems were off. So leading up to, let's say August, then school started, but I had a fever that wouldn't quit back in September when school started. I had to go in for training, and I explained, I called, wrote an email to everybody. I said, hey guys, just to let you know, this is what's going on. I have this, this, and this. And so I don't know what to do. They weren't allowing people in with fevers at that point, remember, So they did give me a few days. They said, don't worry about the training, we'll catch you up and this, that, and the other. And then I went into remote teaching, which was like a blessing in disguise. I was able to work. I was able to literally have to lay down, on my lunch breaks and really take it at a slower pace. The brain fog was outrageous. And a lot of times my kids helped me through, because I'd have to rely on them to help me, with technology or whatever. They were wonderful. And of course, they had no idea what was going on with me. I kept everything hush hush. I just did my job. So that carried on. Well, in March, we had a statewide mandate, everybody back to school. I mean, unless you have medical clearance. My doctor would not give me medical clearance. So I was back in the building. Well, I knew my body wasn't right. I was having a lot of, obviously the COVID stuff, that kind of was like odd and waxing and waning. But the autoimmune stuff had been set up, like really set on fire at this point, because
COVID just exacerbate some of these other things that had been going on for you?
Yeah. Exactly. Yes.
How did you navigate that? You have this experience of dealing with your chronic conditions, and then add COVID onto this medical resume, right? What sort of learning came from all of that? How did you decide to navigate your health?
Well, I got up really early in the morning because I was on a series of medicine. When I say medicine, it's like supplements And there were certain things I needed to do on a good day. This is how I begin my day. I have to take like an Epsom salt bath, really hot, massage my muscles. So I just, in order to get into that building, I had my regimen. I would get up earlier and do all that kind of self-care, get my muscles moving, get myself, fed and the supplements and all of that, so that I could get into work with the students. Unfortunately, that was in March, and by April I was hospitalized. So that did not work out for me. I was really actually trying to ignore a lot of my symptoms too, because I wanted to be there for my students. I loved my job, and I definitely wanted to be a support to my teacher team. And I'm in middle school, so it was really that was April 20th. I remember exactly. I was in public, and I did have a neurological. It's like a seizure, actually. I'm awake, but it is like seizure-like activity. It goes along with Sjogrens. But so that was intense. I was in the hospital for a week, and I kept telling them, like, I've had neurological flares like this, I know, but this one is different. That's what I kept saying. And boy, it was different. I wasn't able to walk or manage. I used my limbs freely. I had no coordination or strength. So that was a week of back in April. And I came home, and I had like rehab folks come to the house, and they worked with me and did different modalities and things. And then this is where it gets kind of weird. Okay, so I was doing my own neurological flare thing, which I've been used to. That's been happening, although it was more intense and very strange and much more debilitating, horrifying actually, because I was thinking, whoa, this has lasted, now it's lasted like 3 weeks or whatever it was. Usually a flare lasts about a week. So I'm thinking, is this my baseline now? These things go through our heads, when we're faced with new symptoms and heavy duty ones. So that morphed into a bunch of stuff. So I had autonomic, tons of autonomic issues, low blood pressure and fainting and the blood pooling and the whole gamut. And then that rolled into this never-ending fever. I'm still with a fever today. I am so happy to report I'm on day 5 of no headache, no brain fog. Ooh, I don't know if I could even be here, to be completely honest. Man, those were rough, and that headache was so direct, and it took out like the sight in this eye. I could see, but it was like a strain. I actually covered the eye. It was something that I had never experienced before. So those were just coming on with every time I had these fevers. That was just like out of the blue, fever would show up, and every single day. So that's like the symptoms that I've been, to this day currently kind of dealing with. So yeah, those are rough. And I will also mention, because this was just so bizarre, when I had the headaches and the brain fog, and there was like also like a band, it felt like just pressure in my head. It was actually changing my thoughts. Yeah, it's not like yes, of course, we're living in pain and discomfort. I mean, I have a really high tolerance for pain, but this literally felt like the pressure in the brain was creating like a lot of, just negative thinking. So that was probably one of the scarier parts of it. Like, sure, the pressure and the pain and and the eye issues, that is all very frightening. But the mental part of it has been, I've noticed, a huge battle for me. I'm sure for many of us, that has been like the silent battle going on with all of this. And I do put up little, I put these all around my room. This comes from a book, Dr. Cynthia Lee. I hope you don't mind me telling everyone about this, but she is phenomenal. She was a doctor, very similar to, just a Western medicine doctor, very traditional, tests and pharmaceuticals. And she got sick in China, and she actually had tons of, things that came from that, a lot of different symptoms. Doctors couldn't tell her, and they finally told her, like, you should see a psychologist. She now is a functional medicine doctor, and she has been my guide. She doesn't know it, but she's been my guide through all of this. And this is one of the things that comes from her book. It's let intuition tell your thinking mind where to look next. And this has been one of my go-tos, because when I'm all into that, like despair, and you're in pain, and you have a new symptom, and and then the fear, and am I going to have a job? I stop it there. In fact, I have another thing on my wall. It says, "Fear doesn't make decisions here," because I'm telling you, it's been a battle. I mean, I'm sure a lot of us with chronic illness can get that.
Yeah. And I wanted to ask you, about what are some of these, sounds like there's some helpful tools that you bring in when you are feeling, experiencing those dark days, if I might, characterize it as that, but,
it's exactly
just some of these things that pull you out and kind of, keep you moving forward.
Yeah. Well, luckily I do have a background. I am a Reiki practitioner. But it's so funny how, just like anybody, right, with our specialties, when we need it, it's like the last thing we get to. But
difficult to practice what we preach sometimes. Especially with Reiki, you can do some self Reiki, and maybe for those who might not be familiar with Reiki, do you mind just describing that briefly?
So basically, what's really neat is through the book here, I also discovered Qigong. So Reiki and Qigong, Reiki is from Japan, Qigong is from China. And the whole premise is that it's a universal energy, or a life force. And that is obviously, all around us and all living things, but within us as well. And so there is the philosophy to it is that there's a flow of energy in our body systems. They're 5 body systems they talk a lot about. And if there is an imbalance, or somehow there's an impediment, that creates disease. And it took my brain a little bit of time. I'm like, no, I've got all these physiological things going on. But I have just given myself over to the philosophy, and I am following actually Master Ming Tong. He is also Dr. Cynthia Lee. She kind of opened me up to this, but so it's Qigong, and I just honestly, you can go right onto YouTube, and some of them are like an hour and a half. Some of them are, half an hour sessions, what have you. But I will say that has been one of the most amazing changes when I am in that zone of there's a new symptom, I'm in a lot of pain, I don't know what's going on. I will go right into his sessions. It's guided. He tells you exactly what to do. And I have reduction of pain. I have reduction of fear. He addresses all this too. It's amazing because he lived, this master, he also lived with illness. So he gets it. It's quite a beautiful thing. That's one of my...
And I think I think it's worth noting too with Reiki as an ancient practice in
Mhm.
alternative medicine, and there's also clinical research that's coming forward
Yes,
over the
I
years to
love
also
that.
support the
Yep.
effectiveness of this energy
Yep.
healing as a modality for facilitating, encouraging health emotionally as
Mhm.
well as physically. So, love when we can get some empirical evidence behind these
Oh,
alternative practices
it's
as
the
well.
best.
Hmm.
Yeah, it's wonderful that the science has really embraced it, really, because you're right.
Hmm.
There's data to back it up, and it's pretty awesome. So that's definitely one of my go-tos. I found very early on, because of living with chronic illness for so long, one of the things, the finding support, you're basically creating a foundation for healing. So whatever that means, if that means like there are people in your life that are gaslighting you, it happens all the time. You kind of have to say, okay, I'm not getting support from them. They're limited in their understanding, and I need to put up a little wall. I'll only tell them so much, and that's just where it's going to be. But then you find your support groups, your friends who are there for you through it all. You find your foundation, and you really have to push the negativity away, because that'll just wear on you. If you're, being told that it's in your head, or you should do this more, get the kind of lack of compassion piece that is not good for anyone. We know that. But so that is one thing I have been very felt very strongly about. They're like family members in the past, I'm like, one thing that's off limits is talking about my body, because I live in my body. And when I want to share something with you and tell you what's happening, you know, that that's where we're gonna leave it. Just because it's just destructive after a while. There's nothing, it could, there's a blaming feeling to that. There's a lot of, it's just not what we need when we are on our, knees in some cases. So
Yeah. Yeah.
yeah,
So in our remaining moments,
yeah.
Kelly, do you mind, anything else that you would like to add to this conversation, or even, imparting words on, someone who might be listening into this and be and just wondering
Yeah,
what to do if they're feeling really overwhelmed?
sure. When I was dealing with all of this years ago, and I didn't have answers, I didn't have any outside help. Um, I did turn. It's a lot. I mean, it really takes a lot. But I turned inward. I I kind of sat down with myself and said, we are going to do anything in our power, in my power, to walk down the path of healing. And I
Mm,
did change my diet. That was within my power. I did a cleanse, and then I did autoimmune protocol. Then I've removed gluten and dairy. And to this day, I still don't have gluten or dairy. Again, meditation. There are all types of meditation. There's sound therapy that is incredible. Whatever works for you. It's, these are things that I could grasp and I could change. Those were probably two of the biggest things. And of course, supplements. I do incorporate, magnesium and fish oils, things that work for my condition, and that I've seen really, really
mm,
work. And the other piece to this, because it is a battle of body and mind, is honestly, and I have been there, oh my goodness, so many times in the depths of despair, and it really makes me emotional. Because that's when you really feel like you're a warrior.
mm,
Just do not give up. You don't know if your symptoms will improve, or they find something. I know for the years I lived debilitated after I came back from China, wow, I thought this is it. But do you know, I was able to improve, and I've been able to, work in incredible environments. I've taught, mindfulness courses for kids. I've worked in the OCD world, supporting them, running a support group. And for me, my joys are serving and supporting people, along with creating and art. So that, that's where I find my purpose and my joy. Boy, but and I tell myself, like, even now, remember back when you thought all was lost? Well, it wasn't. And that this could mean, because right now I'm sitting in a spot where I may not be able to return back to work, and I've got like 8 weeks, and that has created a lot of fear, uncertainty. But I will say maybe there are other opportunities. That's kind of where I have to bring that, those really scary thoughts, So yeah, I really, I just really hope that message gets out there, that please don't give up, as hard as it is. So yeah.
Well, Kelly, it's really been such an honor having you here and just listening to your story. And thank you so much for sharing with us. And
thank you.
Words of inspiration is a wonderful way to bring this into a close.
Well, I really appreciate it. It's been my pleasure. Okay.
Thank you so much, Kelly.
Okay.